at 6:30 p.m. on Wednesday, February 13th, 2019. I'm Diana Malloy, the chairperson of the Board of Health. I'm calling the Board of Health meeting to order for Falmouth. And the first thing we'd like to do is read the mission statement. Kevin?
Okay. The mission of the Falmouth Board of Health is to protect and promote the health, safety, and well-being of residents and visitors of the town of Falmouth. The primary functions of the Board of Health to achieve our mission are to prevent and control disease, enforce state and local regulations, promulgate local health regulations, identify and protect from environmental hazards, and advocate for a healthy community.
Thank you. We have opening remarks and public comment, and then we have our one agenda item this evening, which is further discussion, review of answers to the community questions, and reconsideration of the November 19th, 2018 vote to support the AIDS Support Group of Cape Cod program, which includes syringe access needle exchange. I want to thank everybody for being here. It certainly is a topic that's important in our community, and we know it's kind of contentious with previous location, and we are here tonight to move forward. I'd like to paraphrase, Selectman Chairperson Susan Moran a little bit. She noted that sometimes the problem it isn't really with the concept, but rather with the execution of things. We learn from our experiences and we move forward. Tonight, I hope we're here to move forward, to talk about how this important program, or that's my perspective, I guess, or how this program may support people in our community. Barbara Streisand is a long-time favorite of mine, artist of all times in my head. And one of the things that she always sings about is people who need people are the luckiest people in the world. We have a lot of people in this community that need each other and need the support and programs of health. So tonight we're here to talk about one of them, and we're here to talk about a group of people that needs help with addiction. And also looking at the needle exchange program is to prevent harm for further spreading of the disease. So with that, I'd like to make sure that everyone is aware we have questions and answers this is a summary of the questions and answers from our January 12th meeting. And I want to make sure everyone has copies that would like them, as well as there are questions and answers that were presented either previously or some at that meeting that are answered by the AIDS Support Group of Cape Cod. So those are available. There's also red packets that the support group has provided with information about services and an overview of the program. One of the things that we have been made aware of is that at this point there is a date for an information session that the AIDS support group would like to provide. But I don't want to get ahead of ourselves, but that date is February 26th right now that you're working on. So I'm going to open this up at this point for the further discussion and reconsideration of the vote. I'm going to start with the members of the board to see if anyone has anything at this point they'd like to share. George?
Nothing further other than sort of a repeat what I had said before. I never imagined at any point that I would be sort of in favor of something that would appear to encourage an activity I don't agree with. But in looking at the public health implications of HIV and Hep C, I consider that this is something we need in our community, particularly the needle exchange. However, I also want to support the AIDS support group with all the other attendant services they give with this. So I don't have anything further than I had that Saturday when we had a rather lively discussion at the gymnasium in a rather cold climate.
A little warmer in here tonight. Thank you. Kevin?
I don't have much further to add either besides what we discussed at the high school. I would note that a really important point, there have been questions about whether or not we should be expending these resources to help a minority of the people that have this particular problem. I think philosophically, I just simply reject that notion that society shouldn't help people who need help. And furthermore, a really key point is that this is for the broader society, because these are the injection of drugs is the main way that hepatitis C and HIV are spread in society.
Thank you. Yeah, I think my views on this have been shaped very much by the research that I've conducted on the topic, and listening to everyone's comments from the last meeting. Certainly, one of the things that's influenced the way I think about this was a field trip I took to the AIDS support group of Cape Cod. I met with the individuals that were there, and it was a day when they were running a Hep C vaccination clinic. So their doors were open for folks to go there and obtain services. Anyway, I found the establishment to be the folks that were there to be very professional. I didn't see any vagrants or anything like that might be, frequently ascribed as a potential negative of having one of these. But I admit it was only one day. It wasn't by any stretch a scientific study. Just that's my personal observations from that time that I was there. I will say that I quoted some literature last time, and I think there was a little bit of concern about I quoted some dates of these studies, which were for way more than 10 years ago. And I just want to point out that the reason that the studies are dated then is because that's when the needle exchange programs opened up, and a lot of the questions that were being asked now were being asked then. And after a lot of research, a lot of those questions were answered, and so they haven't been taken up since. And so that's why the literature tends to be a little bit older on this topic. And I'll just quote here from a review that was in 2001 of the needle exchange studies. There's almost 70 studies that they cite, and they say, to date, there appears to be no published evidence that needle exchange programs cause negative societal effects. And for that reason, I remain in support of the mission of the AIDS support group of Cape Cod, although I acknowledge very much that location is going to be critical to the success of that establishment. And so I look forward to see how this pans out.
I'm Steve Rafferty. When the AIDS Action Support Group of Cape Cod came before us in June, they presented their program to us. They educated this board as to the services they provide, and they educated this board as to the extent of the problem within the town of Falmouth relative to AIDS, hepatitis, and other issues that a marginalized population is in desperate need of services for. I was impressed by their professionalism. I was impressed by their desire to work hard with a group of people that a lot of us tend to refer to as them when they really are us. I supported going forward at that time with support for them. They came back to us, and I expressed my support at that time. And the more I've delved into this issue and the more I've looked at this issue, the more I'm in favor of this group and the work they do. I do believe we need to find the best location for them in this community so they can have the most effect on this community to help reduce the scourge that is among us.
Thank you. Scott, is there anything that's new? Okay. So we have some correspondence that I think we should review here that has come in. One is, Selectman Brown still here? Yes, I believe that you received these, but I wanted to double check. You had asked at one point that the AIDS support group provide some testimonial, if you will, from their neighbors about the needles and, if they were on the lawns and things like that. So I thought we could go over, there's 3 letters here that were provided to us. And one of them is kind of interesting. When I first saw where it was from, I thought, Well, does that really make sense? But I think it actually makes a lot of sense. This is from MBR Home Services, and the gentleman's name is Bruno Arez, and he's the president of MBR Landscaping. He also served Cape Cod community. This is his letter. I've served Cape Cod community as a former firefighter and EMT. For the last 14 years, I have operated and provided property maintenance services for both commercial and residential properties. And we have worked with a wide range of clients in those 14 years. I can say that I have seen a little bit of everything, both good and bad. My business has been maintaining the AIDS support group in Hyannis location for 2+ years. And in that time, my crew and I have never found any used syringes on their property. I would like to reassure those that have unfavorable impressions of the life-saving work this agency provides that my employees and I have never felt unsafe servicing the property. Initially, I was unaware of how their services impacted the community, but my experience working with this agency has shown me the importance of education during the heroin epidemic that is affecting Cape Cod. As a local Hyannis resident, a father of 3 daughters, and also as a former first responder, I strongly believe in the importance of the group to prevent the spread of disease and educate the general public. Bruno Ares. There's another letter here from a group that's Positive Individuals Engaged Recovery. It's PEER, they call it. And this letter is from Brian Robbins. He's the director. Dear Falmouth Board of Health, the AIDS group has been a vital agency on Cape Cod in the arenas of prevention, education, addiction as the disease awareness and health supports in the region. They have been a tremendous resource to the Peer Recovery Center of Cape Cod through referral supports, testing, and education for our members, as well as the Hyannis community as a whole. Their level of professionalism has been shown through a highly trained and compassionate staff, free of stigma, with a warm and inviting confidential atmosphere. They partner with agencies like Peer Recovery Center of Cape Cod to outreach at-risk populations, to educate the community about the safety, treatment options, harm reduction, short and long term. Within the last 3 years, we have collaborated with the group quarterly to provide Narcan training and HIV testing for our members and allies. Most recently, outreach specialists from both Peer and AIDS support group teamed up for a safety visit to deliver warm clothing and support to at-risk homeless in Hyannis. This collaboration is evidence of the commitment to the people who may not have the capacity or ability to help themselves at any given time. The Peer Recovery Center at Cape Cod asks that you consider the AIDS support group contributions in Hyannis as a testament to their commitment to community education, safety, and prevention. And the third letter is from the Provincetown area, which I believe is the first site that was up. So it's been running for how many years? 24 years, okay. To the Board of Health, this is from Irene Rabinowitz. It has come to my attention that the AIDS support group of Cape Cod has an application before you regarding a syringe exchange program as part of their prevention efforts. For 18 years, I was the executive director of Helping Our Women, a social service organization serving women with serious illnesses on the Lower Cape. For much of that time, our office was located at 336 Commercial Street, next door to the AIDS Prevention Office in Provincetown. Throughout the years we were neighbors, not one time did I believe that there was any risk to the complex where we were located, nor to our clients, because of the syringe exchange program. There was never an occasion where their operation had a negative impact on our work or the well-being of other tenants in the complex. It was operated professionally with very able staff. Actually, we found it an enhancement to the community. The Outer Cape, similar to Falmouth, has had a long-standing drug problem, especially when it comes to addicts injecting drugs. With a safe manner to dispose of used syringes, the risk of accident from a used syringe on the street basically did not exist. The other issue that was addressed is a counselor is always available to work with the addict who might find treatment or mental health counseling. The program not only prevents the spread of infections through sharing of needles, but provides a safe place to ask for help. This service will enhance your town's efforts to counter the epidemic of drug addiction that it faces. Irene Rabinowitz. We also have another letter from a state representative. Steve, you're going to read that one from David Vieira.
I will.
Thank you.
David Vieira, the state representative of the 3rd Barnstable District, sent a letter to this board. We received it just before the meeting. Dear Falmouth Board of Health members, I am writing to update you on my interactions with the AIDS Support Group of Cape Cod since the public meeting at Falmouth High School on January 12th, 2019. On Monday, January 14th, Mr. Khalil called me back relative to the East Falmouth location. We exchanged phone messages and emails about working together moving forward. Mr. Carlio put Chief Operating Officer Dan Gates in touch with me, and we scheduled a meeting in my office in Falmouth. We have been discussing future locations, conducted a site visit, are researching the potential of a mobile unit, and how to engage the community in the next step when we have more concrete options. This relationship has developed as I had hoped and expected, one of mutual respect for each other's positions and openness to learn from each other. I am confident moving forward that Mr. Gates will work closely with us until a final decision is made with community input. Therefore, I am asking the board to not take any action at this time relative to the letter of support issued to the AIDS Support Group of Cape Cod. Should the positive relationship break down for some reason, I will not hesitate to return to the board and ask for you to rescind your letter of support. I have no reason to believe that would happen. Thank you for taking time to hear my thoughts on this important matter for our community. Sincerely, David T. Vieira.
Dan, I'd like to give you a microphone. Dan Gates, the Chief Operating Officer, has also given us some correspondence today that if you'd like to read to us, that'd be great.
Thank you. Do you want me to stand up here or to the back?
Whatever you're comfortable
I'll
with.
sit. Hi, everybody. My name is Dan Gates. I'm the Chief Operating Officer of the AIDS Support Group of Cape Cod. I'm joined here by Katie Raconda, who's sitting next to me. She's the Director of Prevention and Screening. Joe Carlio is in back there. He's our CEO. We have Leslie Sandberg, who does our press and media relations. Sorry, I'm just going to do a Walton special here. I also have Kim Powers, Eliza, I just went blank. Thank you. And Donna Mello and Paul Gaddu, who's our CFO. So we want to thank the board for your comments tonight. I was touched by those and for the ongoing support you guys have given us in this process. So we wanted to thank everyone for placing the discussion on the agenda tonight. We understand it has been a tough few months and it's been difficult for everyone. The work you do to protect the public health of your fellow citizens in Falmouth is truly an honorable one. Our missions are very similar. They are each focused on the greater good and health of the communities we serve. For us specifically, it is to fight the spread of HIV and other STIs, as well as to provide critical life-saving services to those impacted by the opioid epidemic. We are all just trying to save lives. Saving lives could mean Narcan training for first responders. It could mean access to our emergency food pantries and food deliveries. It could mean being the first non-judgmental conversation someone who is struggling with opioid addiction has. And that conversation could lead, eventually, to treatment and recovery. And it could also mean providing a clean syringe to someone so that they are not infected with the HIV virus or hepatitis C while they are still using. We offer a myriad of services, all with the goal of building healthy communities and saving lives. We are here tonight to assure all of you, as well as other town officials and Falmouth residents, that our priority is to serve those who need help and to continue to build a strong and positive relationship with the whole community. We heard the outcry surrounding 178 East Falmouth Road location, and we are now actively working, as you know, with Rep. Vieira and other town officials to find a new and more suitable space. We have also scheduled the first of several information sessions. As Diana mentioned, it'll be February 26th at 10 a.m. at the Falmouth Jewish Congregation, which is on Hatchville Road in East Falmouth. The one following that will be in March, and it will be in the evening to accommodate work schedules. We will announce that on our website once we have that location confirmed. We hope by that engaging the community, we will find common ground to fight the deadly opioid epidemic that is killing so many of our friends and loved ones. For tonight's meeting, we created a binder with many of the documents outlining our services and answering all the questions you submitted. So everyone has, most people have copies of those. We wanted to highlight a few points. Firstly, we truly believe that our services can, will, and do serve the Falmouth community, and that they are especially important now. Last week, we received a clinical advisory from the Massachusetts Department of Public Health regarding an increase in HIV diagnoses among people who inject drugs. As of February 5th, there is a high alert for an outbreak of HIV across Massachusetts. And here's why that matters. In 2015 in Indiana, there were 180 new HIV infections in 4 months, resulting from one person with HIV. This was in a town of 4,200 people that didn't have access to clean syringes. At the time, people were injecting with about the same frequency as people do now here on the Cape with the fentanyl in the system. Syringe programs were not authorized in the state, and the governor then issued a state of emergency and opened emergency syringe programs as a result of this. We talked a little bit about finances. I know that's come up. Each case of HIV costs $367,000 over the lifetime of treatment costs. Each case of Hep C for one round of treatment is $85,000 to $95,000. One thing to keep in mind, with HIV, there is no cure. With HCV, there is now medication that can eradicate the virus from their system. The Falmouth is at risk for a cluster or an outbreak similar to Indiana without these services. Falmouth is the third town on the Cape with the most syringe access participants, behind only Hyannis and Yarmouth. The closest syringe programs to here currently are ASG's Hyannis office, then our P-Town office, and then it's off Cape to Brockton and Fall River. On an annual basis, we conduct approximately 50 group education sessions in Falmouth and reach approximately 1,000 Falmouth participants through our education and outreach efforts in Falmouth. Donna Mello, many of you will probably know, she leads many of these, and she's a lifetime Falmouth resident. Needle exchange has been legal and funded by the state since 1994. That's 25 years, and that's the data that I think it was, Ben, were you talking about the data, or was that Stephen? Ben. ASG has operated a state-funded syringe program in Provincetown for over 20 years. Falmouth is the 25th town or city of 351 in the state with the highest number of EMS incidents that are considered opioid-related. So I just want to make sure everyone heard that. In the state, 25th highest for medical teams going out to respond to overdoses. In 2018, Falmouth had 101 EMS incidents for a population of 31,000. To compare, Brockton had 2 more than we had, and they have 3 times as many people, 96,000. My colleagues are here to answer any questions you might have, so I'll wrap up by saying that we hope you will continue your support of harm reduction services and want to let you know how appreciative ASG has been for your support in this cause. I have personally really enjoyed working with you guys, and I appreciate the support. I know it has not gone as smoothly as we would all like. I think I have learned from it, and I hope you guys have learned positive things as well. We are grateful for the opportunity to serve Falmouth. Thank you.
Thank you, Dan. I just want to repeat those numbers just for my, so there was 101 EMS calls, and that's just EMS calls, so we have no idea how many people would have used Narcan on their own or anything like that, correct? So it's 101 EMS calls in 2018 in Falmouth alone, not, okay. And that's compared to Brockton had 2 more?
Yeah.
Okay. Does anyone have any questions on that statistic? Yes. So you have to go to the microphone. I apologize. Thank you.
I was wondering if there's any clients of your program here?
They would have to identify themselves if they are.
Okay, it would be nice to hear their story about how they've improved. Okay.
If there's nobody else that's currently an active participant. At a needle exchange program, what I can tell you is, my name's Kim Powers. I'm the Drug User Health Outreach Coordinator for the AIDS Support Group Needle Exchange Programs. I've been doing this work since about the late 80s when the HIV epidemic first started, and we didn't know that's why it was happening, that people were getting HIV from injecting drugs. So my story goes that in 1994, well, before that, getting syringes from anybody, it was illegal. It was underground, and we often reused syringes, and my friends were dying, and they were dying daily. And in 1993, It became legal in the state of Massachusetts, 93, 94, and Boston and Cambridge had the first 2 needle exchanges. So I was living up in that area, and I accessed harm reduction services. They were the first people that were ever kind to me. They were the first people that would touch my hand or touch my arm. They were the first people who looked for me when I was missing. They sat with me, they talked with me, they wanted me to stay alive. They eventually moved into 18 years ago. I haven't injected heroin for 18 years. And I've always used. So this work is really important, and it's really stigmatizing. And this is a demographic of individuals, and it's a growing demographic of individuals where the way I always see it is probably 3,000 people go through Gosnold in a year. At some point during that time, they're using. There's got to be some people that are helping them on that level. We have to help people who are using. It's not only to stem the acquisition and transmission of HIV, but also soft tissue infections, to have somebody accountable to you, to slip in a little love. When you do that, people are more careful. We had 42 report backs of overdoses. People came into the office, told me that either their family member, parent, or somebody that was using with them saved their life, and they did not call 911. That's 42 that I got just in the Hyannis office last month. So that's only probably 40% of the people that are actually coming back and telling us that. So that's a huge number. I work with the Community Impact Unit with the Barnstable Police Department, and I've worked with them for about 3 years. And what that is we meet weekly with Sergeant Ellis and 2 other police officers, and then people from VinFen and DMH and the Council of Churches and HAC, the homeless. So we all work together to try to share information a little bit for our most at-risk people, and we kind of look out for them and try to help them navigate to whatever program will help them make any positive change to save their life. So I talk to the police department daily. My son-in-law is a police officer on Cape Cod. My first thing is for people in the community to be safe. I understand this is a public health issue, and I don't want anyone to ever get hurt. I also do the safe syringe retrieval. So I do sweeps through Hyannis to the hot spots, so to speak. But Hyannis is very different from Falmouth. There aren't people living outside. There's 150 people living outside in Hyannis. That doesn't happen here. So doing the sweeps in the hot spots, it kind of lets me look for people. It kind of lets us figure out who's struggling and also to clean up. I get 3 to 5 calls a week from, Blanchard's Liquors or the school or the library or the police department themselves call, and we go out immediately and do the safe syringe retrieval. If you talk to anybody on the Barnstable Police Department or the Department of Public Works, they will say it's 100% different than it was years ago. They don't find syringes like that. At the Village Green, they had 66 calls 8 years ago, and last year there were 2. So we also collect the syringes from the public bathrooms, the library, outside the police department, at our office. We go to people's houses to get it, and then all the camps in town. I go out with the police officers and with the DPW to help clean up any syringes that are out there. So again, I want to say, one of our main responsibilities to the community is public safety. We want to keep you safe, kids, your families, and most importantly, the people who are using. Another reason to also make sure that the syringes are cleaned up is we don't want people who are using to reuse the syringes on the ground. It's really dangerous for them. And I don't want people out looking for them to use them off the ground. I want them to come in and sit with me. I want to say hi. I want to get you a cup of coffee. And we do an intake for about a half an hour. Every person that comes in any time to get any syringe has to do a risk reduction. So we try to sit and talk about what risk can we reduce today, or what positive change can we make today. So I don't know if I answered your questions, but I will say harm reduction saved my life. Needle exchange program saved my life. And I believe that the town of Falmouth really needs this service.
Kim, that takes a lot of courage to speak up in front of a room about your past. Thank you for sharing that. Is there anyone else that? Yes, sir. You're just going to have to come to the microphone and identify yourself. Thank you.
How long have you been in Hyannis? Been 10 years? Because, well, I was up there. I went up there, you said, Mr. Van Moy. you went there and you stayed at the site. Well, I went up there, looked at the site, and talked to the abutters.
I remember you saying that.
And if you went down 2 over, there's a dentist there. When I asked him, was it Dr. Latimer? He about jumped through the glass to tell me how bad it was. His parking lot, you clogged his parking lot. There were needles all over the place. They were fired, calling the EMTs, calling the policemen, and it was really affecting his business. Then on the other end, you got the lawyer, it's in Manook. I talked to him, and he said, it wasn't as bad, but we pick up needles all the time there. Now, this was within walking distance of where they can return them. Why don't they return them? Go ahead, be my.
You're going to have to use the microphone again. I'm sorry.
So I do sweeps every morning for all the abutters, and we have a thing with them where they're to call us if they find anything. And in the last 3 years, we've gotten 1 call. So the dentist, Dr. Latimer, I understood where his frustration came from, but this was like 4 or 5 years ago, and before we went to court for the lawsuit that we had, right? He's not finding them today. I am there all the time. I have not had 1 phone call in 3 years from any of the abutters, none of them. And I'll talk to Manook because I go over there all the time. And I actually park my parking lot. He lets me have a spot, except in the summer. And so I do, I sweep over there, and I have never found one. I have found like a couple of harm reduction supplies once and a couple other things. But, there's nips every 5 seconds. But there are no, I will tell you, it's not true. It's not happening now.
Okay, you have to take
Okay,
the
I'm sorry. But you say, I've done a lot of research on this, and I agree that we probably need this. But again, I don't think the right spot was near St. Anthony's. But I've read a whole article on how the mayor of Brockton was conned. He said that when he was promised a 1-to-1 needle exchange, and there were far more many needles in the community than he thought. But has that been corrected?
Well, we do better than a 1-to-1.
Yep, you need to be on the microphone.
So we average a 20%, we take in 20% more syringes than we give out. The state guideline is to do a 1-to-1 ratio. I can't speak to what theirs is, but we have been doing it for over 20 years and are consistently above 1-to-1. So we consistently, just to make sure that's clear to everybody, we take in more syringes, more used syringes than clean ones we give out, consistently, year after year.
All I'll say is, as being against this because of St. Anthony's, if David Vieira, if this would be my vote, if David Vieira will go on a limb and say that you will work with him to get a location that won't be near a school, won't be near kids, won't be near a church, then I don't think you'll have any problem. But you have to do that. We can't be conned here.
I hear you, and I will say, if you speak to anyone who's worked with us, we're not a new agency, and we have a really good reputation with all of our partners across the Cape. I completely hear you. We don't do cons.
Thank you very much.
And I think one point I just want to point out with my little demonstration of the needles the last time was really that people can get them anywhere. And you don't even have to be a certain age. You don't even have to give your name out. I mean, you can go to a pharmacy and just ask for needles. And so that is a dramatic also change, and I'm not sure exactly when that changed, because even diabetics used to have to get prescriptions, and I'm not sure what time frame that would
2002.
I think it might be helpful if we have a lot of people that want to speak, that we do a quick roundabout and just get your names on a list, so that, again, we have a little bit of order in how we're providing that. So I'm going to send this back, and if you can. Okay, I'm sorry. Right, yeah, Mallory, I'm sorry, there's somebody on the list, so what's the name there? That's him? Okay, thank you.
I would like to mention one other.
Yes, go ahead.
So when we distribute syringes, we also distribute these disposal containers with every syringe that we distribute. So where this doesn't happen at the pharmacies. Pharmacies are distributing syringes, but they're not distributing syringe disposal containers with every syringe that they're distributing.
And actually, the letter that I got with the needles that I bought was very generic. It didn't talk about bringing them back to our fire department or anything specific to what the Falmouth requests are. So, sir, if you could just state your name for the record. Thank you.
Rolly Bellavo. I have no problem with a business like this. My only concern would be the location. My daughter lives in San Francisco, and at the end of Haight, there used to be a McDonald's, and there was a needle exchange there. McDonald's is no longer there, with 3 or 4 other businesses. It's like a ghost town. It was a terrible place to have that exchange. Initially, they wanted one at the Town Hall Square in Falmouth. Oh, no, that's bad for tourism, that's bad for business, whatnot. The location, I think, would have to be remote enough away from people, and it states in one of your pamphlets also, there's no liability. If somebody gets stuck, if somebody gets injured there's no liability on your part. But I really think the location is the main thing. I'm not against any of this stuff at all. I know a little bit about recovery, but I don't talk publicly about it. It's just the location. I can't say that strongly enough. You know, it's a good deal, but the place is the main thing. St. Anthony's was horrible. We all agree with that now. So do your best to find a nice place that's isolated, maybe near Gosnold. Get a wing from them. They're in the business, you know. And I'll rescind my thing, what I said before about Penzance Point and Woods Hole. I got a lot of flack. So thank you.
Thank you.
Thank you, sir.
Um,
Peter Francis, and while he's coming up, why don't you go ahead if you have a response to that?
Oh, I was just going to say that today we actually were able to meet with Chief Small and Chief Dunn to talk about location selection, and that was one thing that we spoke about is potentially locating near other health clinics as well. So we are in the process of working on that, so thank you.
Sir?
Hi. My only question, well, first of all, I have no problem with the program. Again, I'm the location guy. It was abutted to my home, and
Moving on.
we're
Yep.
moving on. Thank you. But my question is that I just sat here and I listened to some statistics about Brockton having 2 more than Falmouth. I'm not sure if I get that right. Is there a reason why Falmouth is such a hotbed for this particular issue? Okay, well, what I'm getting at is Brockton is considerably bigger than Falmouth.
Yes,
And
very
if
much a
the
city.
number is just 2, there's a reason that there's a problem here in Falmouth. Have we addressed the reason why? Does anyone really know? Has anyone looked at the reason why? I get what we're doing. I want the help. But there's also a second half. What are we doing to prevent it? We're talking about EMTs be going out and being, and the stress on the community. Why are they coming to Falmouth? Is this same issue in Sandwich? Is it the same issue in Bourne? Is it the same issue in Mashpee? Is it the same issue on Martha's Vineyard? I'm just asking. It's a question.
And go ahead, Dan, if you're
Thank you.
prepared to answer, because I don't have those
I'm
broad
gonna
answers.
make this up on the fly if I could, but I just want to say the one thing that stood out to me, and I just want everyone to keep this in mind. It's not just other people. I don't think this is what you meant, but it's not just other people coming from out of Falmouth. This is the people of Falmouth that are struggling with this. And one of our programs, we have a couple of programs, and you've got sheets on it, so I won't bore you, but one of them is, the heading of it is prevention and screening. So when people come in to get tested for HIV or any other STI, we have an education session with them, and we do harm reduction work and talk to them, as Kim was saying so eloquently. It's really a sit down and talking to people that, honestly, I'm sure a lot of people here can relate. This is a stigmatized population. These are people who are hitting a hard time, and there aren't many agencies that are opening their doors for them and will give them a cup of coffee and sit down and hear what's going on with them. I'll defer to Kim, as I always do.
Yeah, thanks. So one of the big things that I found after doing this for years and years and having Narcan before it was really legal, and then when it was really hard to get from other places, as Joe Carlio knows, because I believe he Narcaned me in Boston at one point, which is the truth. He saved my life, and that was a really strange place where we both working together, and I'm here because he saved me. When we work with we have an overdose education Narcan distribution program through the Department of Public Health. And the main focus is to get Narcan to individuals who are using drugs and their families. So in Hyannis, we have blanketed the area with Narcan, and the police department knows it. They want people saving each other. They want families to be able to save their loved ones. So what I have seen in the numbers working over the years, particularly in Barnstable, is that the numbers have decreased because people are rescuing each other. And the fire department and police department will tell you that. It takes stress off the number of calls that are made for that particular situation. And then people are, they're empowered, whether people like that or not. That's the focus of the OEND. And I think that we have over 1,700 lives have been saved with Narcan that's been distributed by the AIDS Support Group of Cape Cod since 2009. And I keep track of that so that when people come in, they know that they can save each other. So that's part of the reason why I think that the number in Falmouth is high. And then you also know there is an influx of people in early recovery, and people in early recovery relapse. 100% of the people that come from all the different programs and go into the sober houses aren't going to stay. It's not abstinent the whole time. They're going to relapse. And we want, like Donna, going into the different houses and the different programs, doing the overdose education for the families and the people who are using so that they can empower themselves and have Narcan.
I'd like to jump in on this conversation just very briefly. I realize we got a new statistic tonight, the 101 in Falmouth EMS to the 102 EMS in Brockton, and it gets our attention. Back when this first came before the board, sorry I didn't bring them with me tonight, but I did gather up from the state the statistics on people that died from heroin and overdoses going back over the last several years, and that's for every community in the state. I don't think Falmouth is unusual compared to an awful lot of this state in the scourge that heroin and opioids and fentanyl are wrecking on our communities across the state. I was shocked at the number of deaths in Falmouth, the increase from year to year over the last 3 years in the number of deaths. I was shocked by the number of deaths in our surrounding communities. I do believe there's probably a correlation that somebody could work out between the number of deaths and the number of EMS events. So I don't think it's necessarily that Falmouth is higher or hotter on this epidemic than any place else. But I feel as the Board of Health that we should work with whomever can help us on this, wherever we can find a way to educate our youth at an early age, provide them better choices and opportunities, create them some economic opportunities so they see hope in their future. Whatever we can do to keep people from getting started, and if they get onto it, whatever we can do to get them off it is critical.
And again, just from prevention perspective, the school system there's so much going on that they're really trying to do and educate and help these students understand the ramifications and things like that. With the vaping is a whole big thing right now. Plymouth is, it was on the Channel 5, I think, the other night, about Plymouth High School has these detectors in the bathroom that are able to detect the vaping because it's so hard to see and to follow, et cetera. So there's lots of efforts everywhere. Our police department, I'm very impressed with what the chief is supporting in trying to, again, prevent and manage what we've got here as a problem. So I wish we had a solid answer for you, Mr. Francis, because if we could fix that, we wouldn't have to be sitting here today. But right now, again, we're trying to work on the prevention, but we also have to manage what's happening and help to treat at the same time. Mr. Finneran is next on the list to speak, please. Sure, send it again, yep.
Mark Finneran. I'm not as much against this needle support as I am against the process. You know that I filed an open meeting law complaint against you. And we all know that you met in July and August and September and November without telling us why. Now, on the Saturday at the high school, you said to us that you knew in October that the needle exchange was going to be in East Falmouth Highway. But yet, you didn't put it on the agenda for that meeting, essentially hiding it from the people in this town. And the way I look at this process now is you basically stole a loaf of bread from us and gave half of it back, and you want us to be thankful. That's not the way good and open government should work. And then your numbers from Brockton, I mean, I got a little theory on that arithmetic. They're 3 times the size of Falmouth, yet they have an equal number of overdose services. I'd say that's probably related to the fact that Gosnold is here and populating our town with people from out of town. And if this in fact does come, and unfortunately it looks like it does, and I've seen this pattern in the way our government deals with us. The roundabout on Main Street was kind of, they used the same fashion, and I just don't find it open and proper. And these questions, again, let me take this one. Why is the group not staying at the Town Hall Square location? Answer, the ASGCC did not request the Board of Health support while they were at the Town Hall Square location. Is that an answer to that question? I don't really believe so. Also, we asked you, the question was, did you contact the Barnstable Board of Health prior to this decision? Your answer is, the health agent spoke with Barnstable's health agent. The ASGCC did not request support or seek permission from the town of Barnstable. Well, I don't see the town of Barnstable tripping over themselves to offer support, as you people are, and the health agent isn't the one who voted on it. So you didn't speak to anyone. None of you spoke to anyone on the Board of Health in Barnstable. They only meet once a month, and they won't be meeting till the 28th, so it's probably going to be after the fact here, but I don't find any of that process open. Why didn't the Board of Health vote to support the group? Again, the ACC did not request support, but again, why didn't they give it? I mean, you want to. And why is the group not using the town hall location? This is similar to the question on the front page. The ASCG did not request health, Board of Health support while they were at Town Hall Square location. Still doesn't answer the question why they're not still there. And I have to comment with your figures here, the rate of hepatitis C has dropped 30% in the last 2 years without any help whatsoever. I mean, that's encouraging. And again, I just have to say that I don't like the way that you do business, and you hid this from the people of this town. There's just no denying that. And I'll never be okay with that.
So, Mr. Finneran, can I ask you?
Certainly.
Is there an ask? What are you asking from us? I could.
I ask that you rescind that letter
Okay.
of
That's your
support, because it wasn't done in a legal meeting. You hid it from us. I mean, and again, Melissa's question, where's your moral compass? You're supposed to be public servants. You're supposed to work for us, but you're working behind our back. And I just find that wrong. And if you don't, you have to answer that yourself.
All I can say, Mr. Finneran, is that we did have meeting minutes from July 30th that explained the whole exchange program. Very honestly, we have
Yeah, but that's not the law. The law is to
Can I
involve
speak,
the
sir?
people
I listened
and
to
notify
you.
them, and you didn't.
I listened to you,
Fine.
okay? At this point, we have received back from the state that we did not break the open meeting law, okay? That is the information we have received back from the state after review of all the documents that they have had. That's what we were told.
I haven't received that yet.
Can I finish?
It's a back and forth.
Having said that, sir, at our last meeting, we did ask that we would like to improve our communications with the community. We want to be more involved. That you can take it for wherever it was, but if you look at who we are as people and working in this community, if you think we purposely tried to get that beyond you and as a con job, then I'm sorry that you feel that way, because I don't know what else we can do to try to move forward with trying to build back the trust that obviously we lost. We, as a group, have learned a lot. We've all admitted that. We're here. We stood there and listened to people really give us a hard time for 3.5 hours, okay? Because we really wanted to hear what you had to say. Not because we want to go behind your back. We're all volunteers here. We spend hours working through this. So you can think what you want. I'd like to know what your ask is, because we really want to try to meet the needs of the community, and that's where we're at. And if I can't make you believe that, I can't make you believe that. So we're trying to build that. We're trying to be here. We're transparent. We're trying to figure out how else we can do our meetings so that they're much more open to the community, so that everyone's well aware of what's on our agenda, because we do want the input of the community. And I think we spent a lot of hours listening because we heard what you were saying. Didn't think it was a good choice. We worked hard after that to make that choice go away.
Well, again, these feelings that you have are all after the fact, and not after the fact once, but after the fact 4 times. I mean, there's just no hiding that. And, you know, it's great that you want to open up the process now, but
So are you asking us, you're asking us
I think
to
that you
what?
should rescind the letter.
Okay, that's
Because
your ask. Okay.
it was done basically behind our backs. If you were going to have that letter on the agenda, it should have been on the agenda, and it wasn't. Not once, but 4 times. I mean, there's no denying that.
So that's your ask. Thank you very much. Thank you for your input. The next person on the list is Misty Niemeyer. Niemeyer, did I say that correctly? I'm sorry.
Hi, my name is Misty Niemeyer. I basically have a quick comment and then a question. First, I just want to say thank you to the Board of Health and the AIDS Support Group of Cape Cod for allowing all of us in the community to comment and to provide so much information to all of us over multiple meetings. I feel as a resident here in Falmouth that meant a lot to me, and I appreciate all of your efforts and hard work to try to bring this service to Falmouth, as I hope everyone here in the room knows, or is well aware how important this is, and that we can't wait any longer. We need to hit this issue that affects our community from every angle we can and use every resource we can. So thank you for all of your efforts for that and for listening to people's concerns and comments. I guess my ask is there a way to provide more of this information that you have here on either the Town of Falmouth website so it can get out to more people? And also, I know you put together a lot of research. Is that already available publicly? I just know I haven't found it is on the Board of Health? It's on your site, okay. So there is easy access to that, because I know you did a lot of work and research to put that together. So thank you.
Mr. Alfonso?
How you doing? Phil Afonso. I think the gentleman who brought up the points of Mr. Patrick, I can't see him back there. I think it just sort of what Mark touched on. Gosnold's here. We're overrun with sober houses. Do we have a number? You're the health board, so I'm guessing you don't. Oh, no, you can't. Okay, so that makes sense. When I go to build a new house, I have to go before your board to put a septic system in. Yet sober houses can be over 150 in the town of Falmouth. 12 human beings per house. And you're okay with that septic system. We have a nitrogen problem in our soil. We're spending millions of dollars to clean up. And as a health board, you don't know the number of sober houses? I could go to, yes you do, you can go to Gosnold. Gosnold has every single number.
No.
They don't. So I couldn't go up there tomorrow and grab a sheet like we did for the Gosnold, getting blocked next to Morse Pond?
You could not do, sorry, you could not do that. There is no licensing, no notification required of sober house. Those people are considered, that is protected, and that number is unknown. So no, and there's no licensing involved. Now, in terms of septic system, it's based
Sure.
on the number of bedrooms. That's what Title V has you do when you do that.
So I could have 15 people in a 3-bedroom house for the entire length of Mara Vista, and it's not a problem?
We had 15 people in a bedroom when I received the complaint. We would apply the housing code to that, and that would be based on square footage.
So all people would have to do is just go before, get a list of sober houses, realize that there's more than 10 per house, and then file a complaint with your board?
Well, there is no list, but first off,
Yes, there is. We got a complete
if
list.
you want to call me with a complaint on a particular property, I would go out and investigate.
Okay, so duly noted, good enough. The next problem here, when you say that we're taking proactive steps for our youth, you couldn't lie more if you wanted to. Again, there's nothing for our kids to do in this town, zero. Whatever there is to do, let's say riding four-wheelers, for example. We have an ATV task force to shut them down. We're not talking about riding across people's front yards. This is out in the middle of the Crane Wildlife Reservation. The rec center's closed on the weekends. I was on that board. Do you have any idea how pissed I was to begin with? You can't get anywhere with it. You can't get an assistant recreation director. So to bring up that there's things that are being done to proactively help the youth, learn about what you're talking about, because you're wrong. And Gosnold shouldn't be teaching in our school systems. They shouldn't be. Gosnold is currently counseling our children through their own private insurance company during school hours. That's great. I've been in therapy for over a year. Therapy is amazing.
Mr. Alfonso?
Sure.
I'm going to kind of try to bring it back to what the agenda item is.
I'm asking you to rescind this letter.
Thank you.
And a lot of people in this community are asking to rescind this letter.
Thank you.
Falmouth is overrun with all of this. The next step is what, a methadone clinic?
And so if you have other topics, that we are very much open to putting other topics on our agenda that we can tackle. There are many, many that we could all tackle. If you have
I'm sober for
specific
6 years also,
Excuse me,
just
sir.
so you feel better. Not everybody wants it.
Alicia Soderberg, please. Lisa, you need to speak at the microphone, please.
A retired professor from Harvard.
I don't know if they can hear you. I'm
I
sorry.
think the major question is, where is Windy Farms? Where's Windy Farms? Do we see Windy Farms anywhere? That's the person that owns the property that we're all speaking about? No?
We're not speaking about the property anymore. We've
Okay.
moved on from that, please.
We have done
Thank
so.
you.
Okay, check. I'll check that off. Okay, well, I've done the numbers since I'm a mathematician, and it seems like you should keep your institution in hiatus. Why do you want to bring it here? You're a tourist. Why do you want to bring it here? Bring it back to hiatus. You're 3 times, like I did the numbers, right? 66 versus 200 and something. You have 3 times as many people that need your facilities in Hyannis. Why are you bringing it here? Are you closing down your Hyannis facility? Okay, so you want to just like separate it and segregate it to half and half, or what are you doing with your clients? What are you going to do with the islands? Because a lot of these people, as I heard, actually live on the islands. So why don't you have your location located on Martha's Vineyard? Ooh,
we
that's
do.
a fun idea. Oh, you
We do.
Oh, okay, so you serve them there. So you're just looking to have one here so you can eliminate the Hyannis facility? No, you're gonna keep that there. Okay. Finances, I won't get into, whatever. Okay, so the demographics for Cape Cod and the islands is 19,000 pounds of needles are taken off every year. Most of them are out of Hyannis. There are 5 spots that are taken out. 1 in Falmouth, 1 in Provincetown, and everything comes out of Hyannis. Keep it in Hyannis is what I have to say. And I think the fundamental question that we have to ask ourselves is, what does AIDS have to do with needles? I mean, you can be infected by HIV by your dentist. It doesn't have anything to do with drugs. I mean, are we talking about drugs or are we talking about HIV? Is it a sexually transmitted disease or is it a needle-infected disease? Let's separate them. This is a Venn diagram of issues, right? I think we should rescind the letter of support. And I think that Gosnold, as everybody has said, should take up this burden of taking care of the needles. If there is really a needle problem, they should take care of it. I really applaud you for picking up the needles because it's disgusting, and I agree. I live in Falmouth. I grew up here. And that's all I have to say.
Thank you.
Thank you.
Is there anyone else that didn't make it to the list that would like to speak? Come on up, please.
Okay. Hi, everybody. My name's Katie. I'm from North Falmouth.
Katie, what's your last name, please? for the record?
Romagnoli. I guess what I have to say about this is that I was living, I grew up here, and I had no reason to be aware of any of these services for a good while, until I became the person responsible for caring for my family member who was dealing with addiction. And when you become that person, it's a lot easier to look around in your town and see the lack of services, because I'm trying to help someone who needs help, and the services are available in Hyannis. The services are available in P-Town. Well, who's responsible for bringing that person to those services? I mean, without having more connections in our community, it's really difficult to say, hey, just go to Hyannis, because I'm 26 years old. I work, I go to school, I'm trying to figure out my life, and now I'm the sole person responsible for somebody who's dealing with addiction. So that's my time that I have to take to try to find services. I think the argument about numbers of people overdosing is kind of ridiculous, whether it was 5 people overdosing or 101 people overdosing. That means there's a need for this service in the town. And I think saying that, criticizing them and asking them how they're going to dispose of their needles or whatever other thing you're trying to say, without them, somebody else is going to be picking up those needles. And if you don't want to do it, that's fine, but somebody else will be doing it. And if they're not trained, the risk is increasing. And it's not a problem that's going away. It's an epidemic. We've already been over all that. So I'm just trying to give you the perspective of a person who's been dealing with this issue. I'm not addicted to drugs, but it affects me. And if it doesn't affect you, you have no understanding of how incredibly scary and hard it is to talk to people about it, to look for services, and how amazingly wonderful and supportive it is to have people not shun or look at you like you're flawed for having a problem. Anyways, sorry I'm shaky. I don't like public speaking. Thank you.
Thank you. Is there anyone else that would like to speak? There was one question, Dan, that I'd like it if you could help us clarify, and I know it's in your answers, but it came up a couple of times. There was a number of about 60, something like that. It was 60 people from Falmouth, but yet there were 10,000 people being treated. So if you could explain that relationship or how that data works, I'd appreciate that.
So the number of 66 individuals, those are individuals that are Falmouth residents that are currently going to our syringe access program in Hyannis. So that's just syringe access. That doesn't include our outreach efforts, as Dan mentioned during his presentation, the thousands of people we've reached through overdose prevention education, HIV, hepatitis C education on an annual basis in the Falmouth area.
Is that clear to everyone? Because I know that question came up a couple of times. Is there anyone that needs further clarification on that statistic? No, we're not talking about the islands. In that larger number? No, we're just talking about Falmouth specific. Okay. Thank you. Are there any questions related to the questions and answers that we have provided so far? Has anyone picked a question that you need clarification for?
I think Mark brought up a good one. I brought up a few, and I haven't heard it. Can that one specifically be answered with clarity rather than?
And which one is that, Phil, please?
The question is, why couldn't this stay in Town Hall Center?
And Dan, do you want to respond to that, please?
Sure. That was it was a barrier for participants to come. So you often wouldn't base a service like this right next to a police department or a fire department or a town hall, because people may have resistance to being in an environment that is not feeling safe to them. So what we did while we were at town hall is we moved to an outreach model. We weren't doing syringe programming, by the way, but we had a handful of people walk through the doors for HIV screening and STI screenings. So what we did, and Donna Mello worked the site the entire time it was open there, we would go out to other places and educate people in the community. So the site just wasn't accessible for the population, so that's why we moved.
That's an answer?
Mark, that's his answer. Do you have another question? Why what? they can go there.
Hi,
They're not comfortable going there is what
I'm Joe
hearing.
Carlio. I'm the CEO of the 8 Support Group of Cape Cod. The site over by Town Hall Square and the discussion we're having really right now do not connect. We made a strategic decision during, as an agency-wide, we serve every town on the Cape, we're on both islands, and we decided to close down our Falmouth location because it was not working. A year or two later, we end up working with the Board of Health, which is what we wanted to do, around providing what is a very critical service in a location that would work for everybody. Obviously, the first one that did not work for anybody. So we abandoned that and we'll look for more. But we didn't leave Town Hall Square because we didn't want to do syringe access there. We left there because the space didn't work, and it was an agency-wide policy. So we have spaces in Provincetown, we've got spaces in Hyannis, and we will have spaces. We would have one in Mashpee, we would have one in Yarmouth. We'd work with every town public health board on these issues if we could, as we did with Martha's Vineyard. All 5 towns approved it, and we're now in, what part of the vineyard are we in? Vineyard Haven. So we're doing syringe access there because people recognize the need for the services and that the Cape is a wide geographic area. So the town hall location didn't work for us as an agency, not because of syringe access. And that's why we left that space. That's the answer as to why we left that space.
Mr. Finneran, do you have another question that we haven't answered? That's a decision.
Gentlemen, I'd like you not to get into it.
I
I'd like
think
us not to get into an argument back and forth. Let's be, everybody be
that's his,
civil
that's his
and ask questions that can be answered.
about why they're not going there or didn't stay there, okay?
Okay. I didn't find that a very acceptable answer. I honestly didn't understand it. But the other question, why, and I'd like, if possible, for you to each answer this question individually because nobody answered it on the sheet. Why didn't you speak with any of your counterparts in Barnstable when they had years more experience with this than you had? And if possible, each and every one of you. I mean, that's a consideration. You work for the people of this town. I mean, we expect you to do your homework, and it seems that you didn't, that you were bound and determined. I mean, I think it was illustrated by your endorsement on the 30th of July without a location. As I said, I'm not against this. I'm against this process. And I still don't like it, and I don't like the answer. So let's see if we can maybe answer that question a little better, if you would. Thank you.
Who did you ask to speak to that question?
All of you individually. Why you didn't speak to any, none of you spoke to anyone in Barnstable on the Board of Health.
I will tell you why I didn't speak to anyone in the Board of Health. I didn't find it was necessary. Scott did some of his homework for us. We are volunteers. We do take some of that information. I've been working with the AIDS support group from the 80s. I've seen what they've done. I've worked with them closely. I was part of the first AIDS support group management team, if you will, at the VNA in 1980-something. I followed them throughout my career here on Cape Cod, and I had no reason to believe that what they were doing was not good work. So that was my personal reason why I didn't need to call. If you want to wait to ask the other members, sir, before you get up, you asked us all to speak.
Am I speaking? I'm just...
No, okay. George?
It's an interesting sort of expression used, that we were bound and determined. And I would say, what is a Board of Health supposed to be bound and determined to do? They're supposed to be bound and determined to protect the public health of their community. You choose, or the selectmen choose, you choose us indirectly through the selectmen, 5 people from the community to make decisions on public health for your community. Those people who are selected by the selectmen are bound and determined for something. It's certainly not the pay. I'll give you, any one of you, my pay right now for being a Board of Health member. We're bound and determined to help the community. My choice was based pretty simple. I knew Provincetown. I worked there as an agent for 5 years. I talked to the agent there, I talked to the people around there, and they said, there have been no problems. I'm bound and determined to give you the best decision I can for the public health of your community. If you feel that my bound and determinedness is in the wrong direction, there are ways in which you can prevail upon selectmen and for any one of us to say, don't pick that egghead again. I've been in public health now 34 years. I served as your county health officer. I've served on the Board of Health more years than I care to even remember. A lot of Monday nights went by. A lot of Monday nights when I was bound and determined to change the public health regulations regarding smoking in public places, to change some of the policies we had about protective means in schools. I was bound and determined. Today I'm bound and determined. That's what I'm bound and determined to do. I made a decision. That's what we're selected for. We have no, I don't invest in anything other than the public health of my community. That's what I do. If I make a bad decision, it's a bad decision. But remember that a Board of Health is 5 people who want to serve their community, believe they can use whatever skills, whatever knowledge, whatever understanding they have. And for the majority of times, I'll tell you, why you probably don't hear anything about a Board of Health agenda, they're boring as hell. 99% of our stuff, nobody takes any note of except in a butter. And every once in a while, I'll admit, we all admit, we could have done things differently. So what is our punishment for that, if you want to call it punishment? We go back through the process, which we did. We sat and listened to it all. I heard some pretty nasty insults to some of our board members that Saturday, but we'll bear it. What the heck? A few stripes on the back won't kill us, but we will still be bound and determined to try to help the public health in our community. That's what we'll do. If we're wrong, I don't know what to say. We're using everything we have. We have probably in Falmouth the most experienced Board of Health you can have. So I don't know how you do it any other way, folks. I mean, it is a process, and okay, I'll say it. If we screwed up, we did a good back ways there, and I'll tell you right now, if we had a motion today to do anything with that letter, I think it would be to sit right where it is, but I don't think anybody will make a motion tonight. I certainly won't. Not hearing everything I've heard so far, not enduring everything we've heard so far from you folks, and we're thankful you're here. Believe me, we won't be here again under these circumstances. We will make sure that everybody in the world can hear our Board of Health agenda if it touches anything outside of a Title V system placed too deep in the dirt.
Thank you, George. Phil, you've not been recognized by the chair. Phil.
Did you reach out to the chief of police?
He has not been recognized by the chair, please. Can we get him? Phil, you're not recognized by the chair to speak. I don't think it's funny.
It's funny to laugh at this matter, sir.
Could we ask him to leave, please? I'd appreciate that, thank you.
Okay, we're done.
I'll be quiet, I'm not going anywhere.
We're done. We're done.
Well,
No,
no.
we're sitting here being attacked by people.
We're not gonna get
It's
attacked.
not- it's-
We're-
what's the point?
Okay.
What's the
I like
point?
to,
What's the point?
Kevin,
What's the point? They want to get us upset. They've got us upset. They're happy now. We're unhappy. What do we want to do next? Do you want to take a vote or no vote?
well, for right now, I think we just wanted to go on with our meeting with, as long as it's in order and we're able to speak. And there was a question asked by Mr. Finnerman, and I'd like to continue to finish it if we can, as long as the meeting can stay in order. Kevin, would you like to share why you didn't call the Board of Health?
Sure. The answer is because I'm awash in information. There's an incredible amount of information about this topic, everything around it. We had the health agent speak with the health agent in Barnstable. One of our members went and visited the facility in Hyannis. We have years of experience to draw from on what these kinds of facilities do and the benefits to the community and the lack of harm to the community. There wasn't any need to go and talk with an angry dentist in Hyannis.
Thank you. Mark, you haven't been recognized.
You haven't recognized my question.
Ben, would you like to answer it?
Yeah, I
You
think
don't
we are
need to.
recognizing your question. You've heard answers from the three of us, so I'm not sure what else you want from us, but I'll give it a shot, although I imagine it probably won't be satisfying to you. So I've spent quite a bit of time on this problem. One thing I know from being a scientist is you can't know everything about any topic. There's always something you don't know. So I did not contact the Board of Health there, but I did do a lot of work on this, and I feel like the opinion that I have on this is formed by the information that I gained. It's also formed by, we received a lot of letters. All of us read all those letters from the folks in the community. All of us heard all the concerns at that last meeting. All of us are hearing what's going on today. So there's been a lot of information that we've taken in. And I'm sure there are other types of information that we could have consulted to in addition to the Barnstable Board that we didn't. So, but you can't know everything. And so I guess it would be one thing if I was sitting here and I hadn't done any homework, then I think, that would be a pretty condemning argument that you're making. But I did do a lot of work, and a lot of the people on this board did a lot of work. And so I guess I'm saying, I just finished by saying I did not contact them, and maybe I should have, but I did a lot of other stuff instead.
Thank you, Ben. Steve?
I did not personally contact anybody on the Board of Health in Barnstable back in June, during July, during August, during September, during October, during November, during December, or during January, or even during this part of February that we have here. Why didn't I do that? Well, I'm sure there's a lot of things that you think are the reason I didn't do it, but here's the reason I didn't do it, whether you believe it or not, Mr. Finneran. Our health agent contacted the health agent in Barnstable and reported to the Board of Health at a meeting what he had gotten from that individual relative to the overall operation of the program in Barnstable, which was not a negative. I did not then feel compelled to use my time to contact individual board members on the Board of Health in Barnstable to get from them a more specific answer as to why the Board of Health in Barnstable was not directly engaging with the AIDS Action Coalition. That's my answer.
Thank you.
Barnstable's 22 miles away. They saw fit, their Board of Health saw fit, to spend the money on a long, protracted case in the Supreme Judicial Court to try to keep it out of their town. I still fail to understand, A, why you didn't contact them, and B, how they can have an opinion that is diametrically opposed to the opinion that you guys share in unison. That's
Thank you for your thoughts. We're going to move on.
If I may. The problem that Barnstable had with it initially was that there was no contact to any board when they went in there. They felt, the police chief felt, that they should have had some sort of, and town council there in Barnstable felt, that they should have went through a process with the town, which they did not. The town sued, town lost. We knew this going in. So it was more of a lack of contact. So the board members at Barnstable never saw it because it was never an agenda item and it was never requested to be on the agenda. So why would you ask a Board of Health member who didn't see it? The agent shut it down at the request of the police chief because they had not sought and they were in conjunction with their town council, feeling that they should have made contact and should have gotten support or some sort of a permit or license. And that was found to be at the Supreme Judicial Court, found in favor of the AIDS Support Group of Cape Cod. And if I'm saying that wrong, Joe, please forgive me because I wasn't there, but that's what the health agent did relay to me.
Okay, is there anyone else? Selectman Brown?
I just want to make a point of information regarding Mr. Francis's question. What are we doing about it? So the police department now has got a relatively new program. If a person overdoses and EMTs have to come out and revive them, they follow up. They go back and they visit with them. They bring somebody from Gosnold and they interview and they ask them how they're doing. What can they do to help them, maybe get some treatment? So it's a relatively new program. We're going to need a lot of good ideas. And what we're going to have to do is focus on, positive ideas of what we can do like that. So I hope we can try to be more positive. Thanks.
Thank you. Is there anyone else? Okay. The board has received the correspondence, as we've read, from David Vieira, and we have received the correspondence from some of the folks from the AIDS support group as far as neighbors, if you will. We have listened and we have provided to the best of our ability the questions and answers. And I wonder if there's anything that the board wants to do at this point in time. Yes, sir.
I'd just like to thank you for your time and the open hearing tonight. We appreciate your how you do it.
Thank you. As we tackle more health initiatives or public initiatives in our community, we hope that we will have this larger group with as much input, because I think we, as a community, really have a lot to offer each other, and I think that's really important, and I don't want to lose sight of that. I think, again, we're trying to help people that need help in this area, and I can't thank you enough, is it Kim, I'm sorry, for being to have the courage to speak to that, because it's not easy, and you're just a poster child, if you will, for how services you can reach somebody sometimes. It's like the smokers, and you may not be able to get them to quit today, but keep trying, don't give up, because you're gonna quit tomorrow. Is there anything, Scott, that we need to, okay, is there anything else from any members of the board?
Do you need a motion to adjourn?
I need a motion for something.
I'll make a motion to adjourn.
Motion to adjourn made by George. Is there a second?
I'll second that.
Second. All in favor? Aye. Any opposed? Thank you very much for all your help.